Thank you all for attending our session, Expanding Care Access with Remote Monitoring, the Tele-ICU Evolution with RemoteSense. So we're really excited to be here today to talk about the Tele-ICU and different technologies, specifically RemoteSense from Nihon Kohden being used there. So today I want to introduce our speakers. I'm here with my esteemed colleague, Eric Cucchi. He's the Director of eICU Operations at UMass Memorial Medical Center. And my name is Elias. I'm the VP of Digital Health Sales at Nihon Kohden Digital Health Solutions. So right out of the way, just get some conflict of interest disclosures out of the way, and let's jump right into the presentation. So we're going to do this kind of like a fireside chat with Eric to talk about the Tele-ICU. So Eric, the first question I have for you is can you give the audience an overview of your Tele-ICU program and its key benefits you're able to provide the community?
Sure. Thank you, Elias. So our eICU at UMass Memorial is monitoring 150 beds 24/7 throughout the UMass system, as well as a number of affiliated and community hospitals throughout Massachusetts. As I mentioned, we're monitoring patients 24/7, providing support to the bedside team, both for addressing decompensating patients, deteriorating patients, as well as triage support. We're involved a lot with what we call population health initiatives, trying to get patients to make sure that they're maintaining all the standards of care that they need while they're in the ICUs, and just really being a resource for the community hospitals, as well as a lot of the learners in our academic medical center.
Yeah, thanks, Eric. Because the Tele-ICU, the program in general, right? A lot of evidence that it helps reduce hospital mortality, reduce length of stay, help have fewer preventable complications. And I think the overarching theme I look at it is it'd be great if every patient, no matter where they were, had access to the expert care in real time that they need to get better.
Yeah, and I think the next slide actually has a picture of it. But we actually, Dr. Lilly, our founder, did a study a couple years ago looking at the functionality of the eICU and what our benefits were. And he found a number of different things through a number of different seminal papers. There was definitely improvements in mortality, length of stay, adherence to some of these population health figures that we talked about, things like stress ulcer prophylaxis and DVT prophylaxis. We also found that there was financial benefits, increased volume. So in a lot of these papers that were published are kind of the basis for why eICUs are growing in popularity throughout the country.
No, tell us a bit about what's on the.
This is a picture of our setup, or at least in our old location. But you can see we have multiple monitors going on. We're staffed 24/7 by two individuals. One is an intensivist, and the other one is an advanced practice provider. Sometimes at night we have an additional advanced practice provider with some pharmacy support at night as well. And what you're seeing here is our setup, and you can see we have a lot of monitors. We have a station with 8 monitors. We're running multiple applications at once. And this is one of the problems that we have in the eICU, in the entire industry, when I talk to my colleagues, is the number of applications that we need. We need one that has access to the EMR, one that is access to the cameras, one that has access to electronic handoff tools, and another one for vital signs. And whatever we can do to consolidate these things has been really helpful. And one of the issues that we've had, especially in the vital sign world, is you can actually see it here, is that we've had multiple applications running at once. Every hospital that we had a different system. Every unit in our hospital at one point or another is in a different stage of development, so they may have different systems running at once. And as a result, I've got 2 monitors running here, and then a whole stack of them on an iPad, and then there was more on the other ones that you can't see there. So this was a big problem for us, is that we just had too many applications, and we needed to kind of narrow that down.
No, thank you for that, Eric. So with that, Nihon Kohden has a product called RemoteSense, which is a vendor-agnostic remote viewing platform. Could you tell us about your adoption of that technology and what problem it helped you solve?
Yeah, so it actually, this program really helped solve 2 things. One was from a clinical standpoint. As you can see, I had 9 monitors running vital signs at once. And this is just not sustainable. When you're monitoring 150 patients across the board, you can't stare at all 150 of them at once. So what we do is we have a system that helps sniff out the sickest patients, and then we use those to put on a single monitor. So from a clinical standpoint, we can now see multiple patients that are sick, our highest priority patients, in one view. So I can take them from multiple different units. So if there is different applications across multiple units, I can consolidate them onto one. And then the other thing is from outside communities, we can consolidate them on one view. So all 8 monitors can come down into one screen, which becomes really important when we're trying to consolidate all these applications. Now, that's the clinical solving and really the most important one, but there was a technical issue too. Some of these other products that we were using at the different community sites were in various stages of version control, you could say, where we had some that are very archaic, and then other ones where the technology doesn't allow you, and firewall rules would not allow data to be sent across firewalls. We had some that wouldn't work with natting, which is basically we couldn't get it from one community hospital to ours through the firewall rules and IPs. So we had technical issues with it as well. And one of the things that this really helped with was be able to kind of circumnavigate all of those issues and bring it into one view for us, which really helped clinically.
Yeah, no, thank you, Eric, because you guys are actually one of the early adopters of the RemoteSense platform, and from Nihon Kohden, like we took a kind of a different philosophy to developing the software. So for those in the audience that may not know, Nihon Kohden, we're a big patient monitoring company in the U.S. So we actually sell the bedside monitors, but we're a relatively small player compared to the big ones. So as we looked at how can we provide better value to the healthcare providers, one thing that kind of came up was like, how do we make their life easier in terms of aggregating the data, showing the data in an accurate, high-fidelity way? So then we developed this platform to be vendor-agnostic. It actually doesn't just work with NK monitors. It works with any medical device that's generate data out there. We're very vendor-agnostic. We're very data-friendly. And then we made it accessible from a web browser. So like there were all these design choices we made to make it as easy as it possibly could in a very complex, interoperable environment with a bunch of different software so that our clinician partners have a product that they could use and hopefully like improve your, not just the patient outcomes, but your also work-life balance as well, and not have to spend so much struggling with the interoperability. So let me ask you, since we're talking about interoperability, can you talk a bit more about the other digital health tools and then how you use like RemoteSense in conjunction with those?
Yeah, so RemoteSense is a vital sign monitor, and what we do in the eICU is we're not using it to necessarily look at it the same way a bedside team would. So the bedside teams are using these tools. They have their sensitivity set for FDA approvals, but the bedside alerts and alarms are really important for the bedside. But being an eICU, I keep saying that we're kind of like the cherry on top. We're the icing. We don't have to be there. What the eICU does is it provides the benefits that I mentioned earlier. So there's additional benefits to it. But being that tertiary level of support allows us to be more interested in specificity than sensitivity. So what I mean by that is that I want to know who I need to look at because the bedside team needs help or there's something going on that they're missing. And in order to be specific, I need better data and I need to understand the data a little bit more. So one of the things that gives us the benefit of having this is having those sniffers that I talked about and having them be specific to be able to prioritize which patients I put on these monitors. So that's kind of the first integration that I use, is I use a tool that will help sniff out patients, a priority score. There's a number of different scores out there that we can use. And that tells me who the sickest ones are, and I put those on my monitor. Those are the ones I watch. I don't need to watch the person that's going to be going home in the morning from the ICU. So I want to look at the sickest ones. And then the second way that we integrate this is with our camera use. So I'm going to use this just like a bedside clinician is. So as a bedside clinician, I'm going to walk in the room, I'm going to evaluate the patient, and then look up at the monitor in the ICU. When you are on camera, you don't have that ability because you're just looking at the patient, and then you got to actually physically move the camera up, and then you got to physically move the camera back. And it can be distracting, it can be difficult, especially when there's a lot of things going on. Maybe you have to monitor the resident, maybe you're monitoring how effective the CPR is. So it becomes really difficult to do that. So one of the things that we do is we actually pull up the patient. What you do is you can click on this and you can actually pull up the patient. So now I'm basically acting like I would in the bedside, at the bedside, where I'm seeing the patient through the camera, and then I have another monitor on my screen, one of those 8 screens that has the vital signs. So it allows me as a clinician to basically function just like I'm at the bedside, which is really important for us.
No, thanks, Eric. So onto that, like you've had a lot of, obviously, you're best in class in terms of eICU operations. You guys have been at it for a long time now. And I guess I would ask you, like, what advice would you give to other healthcare organizations trying to implement a remote monitoring program like yours?
So, you know, we get asked this question a lot. We get asked by a number of different facilities throughout the country to come and visit us and see what they want to do. And really, I mean, there's always a number of considerations when you're starting a large project. There's always capital costs, operations costs, you know, people costs and stuff like that. I can share the benefits of the eICU through the number of papers that we've published. But one of the things that I think gets not well understood, especially by hospital administration, is the technical barriers and the technical difficulties that come with it. And really, one of the biggest issues that we have is all those applications, and then the management of all those applications, because all those applications have passwords and they all have usernames, and you have to manage all of them. And one of my IS colleagues is in the audience today, and I bug him all the time about it. So the thing that you really want to look for when you're building these things is how do you consolidate as much as you can consolidate from a technical standpoint. One, it's important clinically, as I mentioned, but two, from a technical standpoint, it makes things a lot easier. It makes things easier for maintenance. It makes things easier for support. It makes things easier for just ongoing everything. So to be able to combine things into whatever you can, that really becomes one of the most important factors when developing these programs outside of your usual, you know, business requirements.
Yeah, I guess speaking of which, like, there's a lot of vendors we're here today. What advice or what would you want vendors to take away that they may not know about Tele-ICU? Or like, what do you want to see from vendors maybe do differently as they approach providing technologies, products, or services to a Tele-ICU provider such as yourself?
Sure. So there's two things. One is the message I'm hopefully getting across is combine. So combine your things together. Try to get that one, as much stuff as you can. Now, that comes with problems too, because now you have all this information. Especially in the ICU space, we're awash with data. And when I think of it as a clinician, I'm taking all of that data in from my EMR, and I'm putting it into my brain and trying to come up with an idea. And one of the problems is with normal EMRs and stuff like that is that it doesn't have a great way of synthesizing all of that data. So we as clinicians are left to do it. Now, that's fine when you have a couple patients, but when you start adding, you know, an entire ICU, which is 10, 16 beds, when you start adding multiple ICUs, when you start adding multiple hospitals, and you start expanding these things up, it becomes really hard to see which patients to look at where to start, how to prioritize your day, and having a way to synthesize that data into some sort of summarization that is clinically relevant is important. Now, I want to stress that clinical relevance because, as much as you guys don't want to hear this, there's a lot of stuff in the technology world that either the clinicians didn't have much input on, or you're trying to solve a problem that isn't really a problem that clinicians think. Clinicians want one thing. They want actionable information. I want an information and I want to do something about it. I don't want information just to have it. So when building these things, we need to collaborate with clinicians, answer the questions that solve the problems that they have, or at the very least, give them the information that they can then do something with. So that's what I think the two biggest points are: is work with your clinicians, involve them in the process, and help them understand the problems that they may not know exist. Apple always gave us those things that we didn't even know we wanted an iPhone until it existed, right? And there's a lot of companies out there that can do that same thing, but we need the clinicians' input. And they're like, all right, this is what we can do. This is what we need to do to support you.
Thank you, Eric. 'Cause I think I'll also say as a vendor at Nihon Kohden Digital Health, is the way we look at it is we're partners and we're here on the journey with you to get us to a future state we're probably never going to reach, but we always can strive to achieve it because it's super complex. There's a lot of different vendors out there, a lot of different technologies. So I think Nihon Kohden has a very powerful portfolio, but I think you have to find the partner that's willing to work with you to achieve those goals as opposed to just trying to sell you a product.
Absolutely.
So with that, I want to look a little more future. Where do you see the Tele-ICU? What are the major trends you believe you're going to see in the next 3 to 5 years that are going to make an impact to your practice and then your patients?
I think that one is consolidating the data and getting it in there. I think I've made my point on that. Yeah. But the really where I think it is kind of figuring out how we can build tools that are going to be that actionable tool. Now, there's a lot of AI technology out there that can predict things. So you can predict a patient may need to be on pressors under a ventilator, but there's data out there that suggests that even if I start non-invasive ventilation for patients to prevent ventilation, it doesn't actually prevent ventilation. So if we're going to be building tools, either using AI or traditional rule-based tools, I need to know what that actionable piece can be. So we need to kind of work together in order to figure that out because I have ideas, but there are plenty of things out there that I don't know that can be done yet. So it's working together and collaborating.
Yeah, it's definitely, we're still in the data phase and we need to get to the action phase.
And we're doing this as a nation, right? We all just went to the EMR within the last 10 years, and now we got to figure out what to do with this beast.
Yeah, because it's super fascinating. You have a ton of data, and half the time, the data that you have, you probably can't even access it. Then if you do access it, what decisions or change in behavior that drives? I'm always a believer that if we're giving you information, it should be actionable. It should change your behavior in some way. Otherwise, why do you need that information?
Yeah, exactly. And it's we went, like I said, we've gone from paper to data out the kazoo, and we just need to figure out what to do with it.
Yeah.
Same as the airplane. Within 60 years, we went from the airplane to being on the moon. So,
yes.
This is maybe in the propeller phase right now.
Yeah. But it's very magical, right? Because you could see, from other industries that, there's a lot of opportunities for healthcare with the technology stack that is generally available to have it turn it into impactful solutions. Where I want to kind of highlight Nihon Kohden Digital Health solutions in our technology stack. I think one thing I want to highlight specifically is the data sources we're agnostic to. We collect data, we have our own monitors, but any other device out there, we can aggregate data from. We have partnerships a lot, but we want to make sure that your data is free, and we have a very data-friendly policy. We have our digital health platform, which is probably the most, my opinion, most flexible and powerful platform out there to aggregate data, to compute on top of it for storage and then streaming. Because we were originally a patient monitoring company, so we're really good at high fidelity waveforms. So we could stream all that. And then we have a variety of applications that work on top of that. We just highlighted RemoteSense, but we have a variety of other applications and working continuously with our partners to figure out, hey, you have this kind of trove of data that's either retrospective or real time. How do we present it to you or process to you so that it fits into your workflows thoughtfully and then allows for a meaningful outcome for the patient, the population, reducing costs, but also helps with your work-life balance. So with that, I want to close the talk. Thank you, everybody, for joining us today. Hopefully it was insightful. Thank you, everybody, for your time today. And yeah, have a good HIMSS.
Thank you.